also able to share slides if you want. I mean, the slide point. I have a slides I can share. I know a lot of people sometimes can be visual too, right? So
Oh,
if you allow me, I can share too, right?
yeah.
Mhm.
Well, hey, I'm super excited you're here. We have Dr. Clement, who I've been a fan of for a little while here. And if you haven't met Siba Health, I'm super excited to have him share in this month in our Nurses Roundtable. Every month, just so you know, Dr. Clement, we connect, we share, we sometimes we have a brilliant guest speaker so that we can be smarter. Wink, wink, nod, nod. Um, and we share information as well. So we're just so happy and really grateful for you taking time out of your busy day to share a little bit about the magic behind, what is Siba Health? What are you doing? Because there aren't a whole lot of players. I talk to people all the
Yeah.
time about there's a big difference between risk mitigation and management, right? There's
Yes.
plenty of diabetes management out there. We'll cut you a better deal on your insulin, but tell us what's so different about SIBA.
Great. And then again, really, it's always very exciting to be here and really to speak with fellow clinicians to really share, the vision behind why SIBA got started, right? So for me, as a clinician myself, suddenly I've seen firsthand the frustration from a provider who's, I mean, a clinician like me, you all here, and as well as from a patient perspective, really, looking at what's the current care model today, addressing some of their needs, mostly patient with chronic condition. There's a huge gap, right? I mean, in terms of how care is accessed, how care is delivered, and really, again, at what point do they even actually be able to secure an appointment to meet with the provider? There's a lot of moving part, and then that's the reason why our healthcare system today it is where it is today. And so my training as a clinician, obviously, led me to begin to think about what sort of innovation do we need to do here, right? And how do we need to deliver this care that is truly, truly tailored to the patient's unique need, because the one size fit all approach or the symptom based approach, it's no longer working, right? Everybody is like, okay, what else? A lot of people are on Google looking for solution, but that's like almost like going into a rabbit hole. You keep digging in and you never come out of that. And so this is what led me really to leave being on the patient bedside to begin to think about how can I be that agent of change? How can I be that person that is innovating, that is disrupting the status quo today? Understanding that from a provider's lens, and also my interaction with patient. But again, you also need to think about how are the health plan, this employer who are paying for some of this to provide access to their employees to access care today. Where are the frustrations for them specifically, right? Because a lot of them, it's the chronic condition today, it's a huge cost driver for everybody, be it obesity, type 2 diabetes, be it some of the GLP-1s, autoimmune, mental health. So when you look at chronic disease, so let's look at type 2 diabetes today. Type 2 diabetes does not just happen in vacuum, right? There's always a reason why it's there. So what SIBA is doing really, that it's really unique. If you can give me ability to share my screen, I want to share a slide. Yeah.
You should be able to drive. We'll let you drive.
I love it. So this is it, I think. Let's see. What can you see here now? Can you see my?
Yeah, okay. We see your desktop.
Oh, my desktop? Did you say SIBA overview or what does it
Yep,
say?
SIBA. Yep, there you are.
Oh,
Multi-product platform.
excellent, excellent. So, I mean, I'm not gonna bore you guys with, some of those key differentiation. Now, let's look at this first, right? So, look at this. What we did and why we started SIBA was to really begin to look at multi-product, because if you look at chronic condition today, it does not happen in isolation, and there are other elements that either there's a primary reason why patient is coming, but there are other secondary aspects to it in terms of some of the comorbidity, right, that is associated with this. How we are addressing that from a patient perspective or from a health plan or a payer. Because there's a big challenge with the fragmentation in the space today, right? Because one is lots of point solution, right? So SIBA fits in well into when you look at a patient, the primary care model and the specialty care. So we're in the middle where we probably provide that whole sort of whole person care, right? Again, looking at that person as a whole, rather than looking at just say this patient comes to you today, the patient has a headache, and you manage the headache, give the patient a Tylenol, and the patient go back home. Have you solved the problem? No, because the reason why that patient has the headache is still there. So what SIBA really, really does well is our ability to really leverage data that we collect, right? Either data from what I call the biomarkers that we do testing, the custom panel that we put together that allow us to zero in specifically on why do you have the condition today. So this data points include, our ability to collect a very, very comprehensive questionnaire from this patient, right? And that allow us to dig deeper. It asks a lot of questions around, environment, exposure to environmental toxin, your lifestyle, your culture. It asks about micronutrient deficiency. It asks about your sleep. It asks about, what other cofactors that we're missing, right? So that we can get a very holistic view on this individual. And the other element that also add to the data point is our ability to collect data from the connected devices that we send to the patient. So in the case of type 2 diabetes today, we send what I call the Freestyle Libre, the form, the Fitbit that tracks activities, that also tracks sleep, that also tracks, heart rate variability, rest and heart rate. And then we also send them the blood pressure monitoring cuff and the scale for their that measures their weight and as well as their BMI, right? So this three data is collected. And then remember, we have data from the patient from lifestyle and behavioral component, and as well as this bucket data coming from the comprehensive lab testing that we put together to do so that to allow us to zero in and, okay, why do you have this condition? So once we do the analysis, we're able to now put together a tailored approach that allows us to deliver intervention that would focus on the root causes, but also the ability to reverse this condition. Because if you're able to get to the root cause of this condition, the symptoms, you are able to put together intervention that can reverse it, right? So that's why SIBA is really delivering what I call the integrated care sort of model, right? Really, that it's focused on really a whole person and rather than just a symptom, right? So, and when you look at who SIBA is today, we're not just providing those patients with the condition alone, but we're also looking at patients that are high risk, right? Based on either the data point in terms of their exposure, either they have history of type 2 diabetes, or we see certain data point that is pointing that this patient can develop or will develop type 2 diabetes in a month or two, within a timeline that we're seeing. So we're able to prevent it, right? So when you do that, now you're also preventing the future cost avoidance, right? So the question?
Can I butt in here, Dr.
Yes,
Clement?
please. Yes,
Because
please.
I think it's so fresh. And matter of fact, today I've talked with a few brokers, advisors specifically about the impact that we're seeing. And a lot of folks, a lot of brokers, they're looking for they're looking for something like a wellness program, but they're sick and tired of wellness programs because they don't deliver anything. Meanwhile, I had a broker the other day tell me I have more sugar in my group than a bakery. Right. So, and it's driving all this other cost. And you mentioned a little bit earlier, and I think one of the reasons why a program like this is so important is that diabetes in particular, and you mentioned that your SGLT2s and your GLP1s, which are getting so much press right now, and they almost have like a bad guy cloud over them, and they're not. And what we see, and Stephanie she has worked tirelessly for a lot of our members in tracking down, sometimes they can't get these meds because of the shortages. And we've had folks that have had to go back on multiple time a day injections of insulin, for heaven's sakes.
Yeah.
Or it's just ridiculous. And so we think about that in terms of, and especially I like that. I don't have diabetes yet. My doctor says I just have a touch of sugar. I love that one. The pre-diabetes. Well, when you implement a program like this here, You don't have to wait until they get on those expensive SGLT2s or GLP1s,
Yep.
which those aren't the bad guys, right? Because they're protecting the heart and the kidneys. And, for kidney care, there's standards of care. And now that people can't get them, or they get them here and then they can't get them, so they're on and off, that's going to show up in terms of outcomes and the cost. Maybe they don't have it right now and you're saving money, but they're going to show up with a heart attack or renal failure down the road. And then, what did you
Yep.
do? Save $1 to spend 100. So
I agree. I agree. 100%. I will give you a very good example that happened when one of our biggest client that is also in somewhere in Arizona. They're in the transportation and logistics space. So they had an on-site vendor that provide services for them, right? So, because the way SIBA look at this, they brought SIBA in because that vendor was not able to address those high-risk patients or those patients that are driving their cost, or they were not able to drive engagement. So they brought SIBA in to see how can you help us really to manage those patients that are driving us cost. They have 2 employees or associates within that organization that was costing them about $400,000 a year. 2 employees, right?
yeah.
So if you look at one of the reasons why either employer or health plan is coming to us today is looking at, okay, how can we lower cost? But not just the cost alone, how can you also optimize, right? I mean, the health of our members. And then really seeing how you can also empower those members as well to understand, their own unique, their own the unique healthcare journey. How is that helping them? What are you using to empower them to get them engaged? Because when you drive engagement, you're able to achieve sort of the desired clinical outcome, right? So
Sing
it's
it,
important.
Doc. Sing it.
It's important, right? So, for us is to leverage this technology, like connected devices that we send to them so we can track data trends real time. So this particular patient, we noticed that the patient's heart rate variability, the resting heart rate was trending, in a direction that it shouldn't be at all. We felt that there's something wrong here, right? So this patient was not sleeping well in the first place. So, and that's the reason why we track sleep. So we look at sleep and we see that your resting heart rate, is not giving us a data point. We know that either you have sleep apnea or there's something that we're missing, right? We're able to
Yep.
send this patient specifically to a sleep specialist that will look at that, right? So you're providing that care coordination. So with this patient, we knew that there's something off. And so our health coaches quickly, because they have a dashboard where they see what's going on with this patient, quickly connected with this patient because they got an alert that specific data point has been trending in this direction for a few days. And it's like, now. So they reach out to the patient, hey, how are you doing? And he said, he's okay. And any issue, temperature or anything, any physical pain, nothing. So the patient also saw that data because he has access to the data coming from the RPM. But the patient felt that maybe the device that was tracking the heart rate variability, it's actually malfunctioning, right? So because there was no physical anything, and like no. And so we said, no, I think you need to go see to the OR because the data, it's not making any sense right now. We know that there's something off, right? Luckily for us, the wife is also a nurse. So she saw that data. She said, no, we gotta go to the emergency room now. Believe me, they got there. The doctors look at that data, immediately took that patient into the OR. So can you imagine what would have happened, right? So this is also addressing really, you're not just bringing out a solution that is innovative, but how are you also empowering patients to be able to be part of, their own healthcare journey, to be able to understand why you're making certain decisions, right? So you have to empower them, right? When you empower them, you drive engagement, you build trust, you build relationship. These are the key elements that is lacking in our healthcare system today. We're all clinicians now. We know what that is today because right now the private equities are driving that because it's all about the bottom line and the numbers, right, for them, right? So it's very transactional. So you will save that patient. That you can imagine what would have happened with that patient, right? I mean, with those
What
numbers.
was the diagnosis with that patient out of curiosity that they needed a surgery for? Was it
So
an
I think,
aneurysm or?
yeah, and yeah,
Yeah.
I think it was an aneurysm. So I don't have the clinical data, but I had to go back again and look at it. But again, I was just trying to illustrate the power of technology, the power of building that sort of approach to really helping patient. This patient has type 2 diabetes, right? And then that's why the patient was part of the system today. There's another patient that his EGFR was completely out of whack. And the on-site vendor did not see it. There's no way you have a CKD that starts overnight. I mean, you guys are in the space today, right? And
Oh, thank you.
they didn't see it. They did not see it. It took Siba to see that. They send that patient into, now the patient is undergoing dialysis, right? Can you imagine? What would have happened?
Yeah. Oh, you're singing that's how I came to this space, was in working in home health. And it's interesting because a lot of our members, a lot of the same folks that you're working with, they're working folks, right? And
Yes,
so most of these folks are going to be followed by a family practice doctor or an internist who's looking at, the generalist, which is fantastic, but they're
yes.
not the specialist. Like I can't tell you how many times I've seen that same scenario play out where, we look at a member and you can tell they have all the risk factors. They got all the things that are tearing up the inside lining of their blood vessels, right? They've got diabetes, they've got high blood pressure, they got high cholesterol, they got sleep apnea, they're smoking, they're overweight, all these things that we know are going to tear up kidneys and hearts and livers, and sounds like Venom. If you've watched the movie Venom, the kidneys and pancreases.
Exactly. Yeah.
Anyway,
But how did they miss it? That's the question. How did they miss it? Right. So
well, it's
because
because they're not specialists, right? So I can't tell you how many times I've talked with docs and did you see their GFR? I mean, we've had people sitting at 17, 18, 20% kidney function and still no diagnosis of kidney disease. Happens all the
all
time.
the time. So I'm
All the time.
glad, yeah, I'm glad we all align on, so again, at the end of the day, it also boils back to, how the healthcare system today is structured and built, right? Because it's certainly very transactional. The doctors don't even have time to look at those data because,
Yeah. Yeah.
you spend less time, in providing that because you have to spend a lot of time in the office back end work where you look at
I
all those
got
data.
5 minutes with you.
Exactly. So this is where technology comes into play, right? So when I tell people is healthcare cannot just be technology. The technology would create efficiencies and optimize how you deliver care, right? And then provide you with information that you need at every given point. But a lot of people think it's just AI, machine learning is going to come in and no. I said, listen, there has to be a human element, no matter what it is. A human being has to be in the loop. So I'll show you another slide here again that also look at how Siba model is really structured, right? So I'm not going to bore you guys with this differentiation. I can share this slide with you guys, right? But this again tells you about the unique methodology and how we look at root cause medicine and try to understand, how can we better support patient moving away from that symptom-based approach, but specifically leveraging integrated care model where you have the doctors, dietitian, the nurse care managers, the health coaches, all working collaboratively, all communicating at the same time, be able to see decisions that the doctor make, the decisions that the dietitian makes, the nurse make, all under one platform. So what you do is you really remove the silo, right, from how we deliver care now, communicating at the same time, real time, everybody's seeing that information at the same time and understanding why you're making certain decisions because it's driven by data. It's there to show why you're doing what you're doing. So here is really when I talk about root causes, right? You can see here where you talk about symptoms. A lot of us today, the healthcare model is focused on symptoms, looking at high blood pressure, all that. But SIBA is looking at
For that,
deeper.
right? You can
Yeah.
match up a medicine for every one of those things, doc.
Yeah. So for us, it's inflammation markers, stress markers, poor diet. We look at toxins, lack of sleep. Sometimes relationship also play a huge role in our overall health, right? So we're looking at nutrient deficiency, lack of exercise, some of those toxic thoughts too also play a huge role, trauma, genetic, poor digestion. So these are some of the elements that we look at and really to understand why you have your condition, right? Not just because, oh, you have type 2 diabetes. There has to be a reason why you have type 2 diabetes. We're not going to try to say, you know what, don't eat rice, don't do this, right? Because you're not looking at a one size fit all. Because when you do that, a lot of patients, because, you can, an Asian patient today, you say, don't eat rice. It's almost impossible because it's already part of who they are. So you need to figure out what we call the metabolic flexibility, right? Which means the ability of the human body to break down carbs, fat, and use that efficiently as fuel. So the ways you do that is get to a root cause, get the patient on a diet that's truly personalized based on their unique biochemistry. Because again, that's why you give them the Freestyle Libre. The Freestyle Libre will track, spikes in their blood glucose, right? And then it's time stamped with what they eat. So the patient are required to take a picture of what they eat, upload that into the portal. It's time stamped. When we see a spike, we know that, okay, is there a specific element or ingredient in that food that is actually causing the problem, right? And so when you do this lab testing, it
Yeah.
allows you to dig deeper. You look at the gut microbiome, you look at all those markers, right, to ensure that you're not missing anything. People say, isn't that too much? Well, but the data say otherwise, right? Because it points you to a different direction. So that's what we follow. We go based on the data, what the data tells us. Questions, comments?
I I think that's impactful. You can't change anything if you can't see it. And, the
Yeah,
traditional approach is going to be to give people a list of what they can and can't have.
exactly. Put medication, restrict them to a diet. That's not going to
Yeah.
work. We
Yeah.
have to look at it and say, okay, maybe minimize it, or because we look at this is actually triggering, a spike in your, continuous blood glucose. Maybe you minimize it, or we'll probably eliminate that a little bit, right? And put that patient on a plant-based diet that can also help them to really what we call to improve the mitochondrial function, right? Which is very important, right? It helps to remove inflammation. Inflammation plays a huge role on our overall health, right? It can affect your sleep, your weight gain. So when we're able to
Cancers.
correct this, you
Yeah.
can see that this patient is actually being improved, right? Because, the important element is how are you helping this patient to understand what's going on in their body, right? Not just I make a decision, take this, go home. No, you got to carry the patient along at every given point in how you deliver care, right? So, and
Yes. Yeah.
and when I look at chronic condition, when you talk about mental health, right? We believe that any patient with chronic condition, there's an element of sort of, behavioral health component that it's there. Either there's anxiety issues, depression issue because you're worried about you either die or you're gonna lose your limbs, you're gonna get kidney diseases. That also leads to anxiety. So we want to fix that. So that's why we call it a whole person approach, leveraging really interdisciplinary sort of team coming together, right? So you have a health coach, you have a doctor, you have the personalized health plan specifically. This is what all of them here, you see this line as they're communicating, whatever they're putting together, everybody is seeing that, right? At the same time and understanding why this has been put together. You have a dietitian. This is what we call a nurse care manager. That's part of this care as well, right? So it's really, really a very multidisciplinary sort of approach, which is integrated into what we do every day. The patient is in the middle here, surrounded by all those people here who are working for the patient to help that patient optimize, to help that patient understand why they have what they have today. And when you combine all this allows us to deliver a care model that is truly, truly personalized, a care model that gets to the root cause of your condition, a care model that empower patient, a care model that provide visibility from a patient perspective, from a provider perspective. But again, you're able to also provide that care coordination for the patient and send them to, where they need to go to if there's a need. So I can, be able to look at the patient and say, okay, I need to send the patient to you guys because this patient has saw risk factors in terms of, might develop some sort of chronic kidney condition or something, kidney diseases. That patient goes to you, right? Because we are not expert in that, but we've seen it and then we send that to you. But the most important thing is that, chronic condition today, they all have comorbidity, right? So how do you address those comorbidities? And we strongly believe, when you leverage the intervention that include a personalized diet plan, looking at the patient lifestyle, the behavioral component, but most importantly, to get to the root cause of why does patient have this. And I
Yeah.
will tell you today, we have thousands of patients today on SIBA today, 98% success rate in terms of our ability to reverse this condition. And really driving engagement, 75%. These are data are there. I mean, we're getting the validation now, Institute to validate our data. That we'll do a publication on that specifically, right? You're
Yeah.
driving reducing medication use reduction, right? So because we have doctors, we're able to also really manage, de-prescribe or prescribe too, right? Because again, sometimes patient might need it, sometimes they might not at some point, that at that point, okay, maybe let's combine the intervention as well as medication. But at what point do you not know that, okay, you want to begin to reduce the quantum of medication? As you know, patient with chronic condition, mostly type 2 diabetes, they're on 10, 15 different medication. We have 85% medication use reduction over 12 months of intervention on the platform today.
Got the back door. 85%
Yes.
reduction in medication.
Use, yes.
Now, who doesn't want to save money on their SGLT2s and GLP-1s?
Exactly.
Shut the back door.
Exactly. But we want to do it, want to ensure that data is telling us this is safe to do. You don't do it because you want to save money.
Yep.
No, you want to do it looking at that data. You're also sharing
because
that.
they reversed it. They don't need it.
You don't need it. And then you put them on, and the patient now at that point, they have the tools. They have the understanding why they have what they have today. They're able to now really either minimize those activities or whatever that is causing those problems, and now able to now understand what they need to do. But if they're having problems, they're able to engage with you again, right? And come back and say, hey, I think I'm noticing certain data. But because they have devices, we're also looking at trends, right? And seeing if there's something, and then it highlights that and flag provider specifically to that point and say, look at this, right? You're saving them, doctors, the time to review a lot of data. The technology allows that to point you specifically to this, right? And say, look at this. Maybe there's something here that you're missing.
Well, and teaching patients, we hear that all. I love it when a patient will tell me, well, my doctor takes care of that. I have never yet, maybe you're different, Dr. Clement, but most doctors I know are not going to come over and cook me breakfast and take me for a walk and make me get out of bed, make me go to bed at a certain hour. I haven't met a doctor yet who's going to do that, but I love that approach. The other reason why I like that so much is when I think about that, I think a lot about how a lot of times people are, my doctor takes care of that. I don't know, my A1C something or other. My doctor's going to tell me if it's off. And it always strikes me. It's like driving down the road blindfolded. And only you're driving down the road forward, but you're only looking over your shoulder while you're driving down. It's a matter of time before you're going to hit a freaking tree. Right.
Yep,
so
exactly.
when you see all the data that you're gathering is the very information that people need to make that change. And the fact that you drive a 75% engagement rate, that tells people don't get engagement rates. And I think that's something really important. Every broker, every advisor, every health plan out there wants to know what's your engagement, because they're sick and tired of paying a PEPM for something that's not going to drive value. The only reason why people can't engage members is because there's nothing in it personally for the member.
No.
Most of these folks that are going to need this program, they've been case managed to death. They already know what, if it was a matter of knowing and education, I would be my perfect weight, Dr. Clement.
Exactly. You have to really get tools that help with behavioral modification, right? And lifestyle. So you track activities. A patient with a CGM, get an alert if your blood glucose is actually shooting up, right? It tells you. And then say, hey, with the Siba now, it says go for 15 minutes walk and 15 minutes walk back, which is 30 minutes. Easy, simple, right? I mean, just as simple as that. But
and
you
they
also
see for themselves what happened because of it.
Exactly. If they don't do that, what would happen to you, right? And also you create a community. So we created a community where people also are able to share and talk about their experience, how they're doing in terms of their data. That's so powerful and so compelling, right? And really, one of the reasons why some of the traction Siba is getting today is because we're able to build that. Now we're actually onboarding Blue Cross Blue Shield of California and Blue Cross Blue Shield of South Carolina. Because, one, prediabetes and type 2 diabetes is a massive problem for them, right? So they look at Siba's data over the time and it's very compelling. They said, you know what, well, we want to try what these guys are doing today. And when the patient comes in, if you listen to the patient testimonial, really, because it's a high tech, high touch, right? I mean, really, because
high tech, high touch. Yeah.
Yes, very important. That certainly it's what really helps to deliver value. But you're not just looking at fancy technology. The key core KPIs that you measure, right? The A1C level. Our patient, by the end of the 12th month, the A1C level is below a 5.7 or at 5.7, right? So someone that comes into you today is at 6.5 up, right? Which means you're diabetic, obviously. Between 5.7 to 6.4, you're pre-diabetic. Most of those patients, they lose about 30 pounds of weight that is sustained. You're not just losing that weight that once you stop, it goes back up. No, it's really weight that is sustained. You lose that weight, it's sustained. You have tools that can help you to continue to sustain that, right? Rather than,
well, because you're creating habits of self-care that drive the result. That's the real trick.
Yes. and giving them those tools that they see themselves, they
Yeah.
track their trend, they see how well they're doing. Because if you ask them, like, why, what are you concerned about with type 2 diabetes? Oh, I don't want to lose my sight. I don't want to have a chronic kidney disease. I want to be here for my grandchildren. So
Yes.
what do you want to do differently? You know? So when they see that tools,
Absolutely.
you build relationship, and then you're not restricting them saying go on keto diet. You know, you're not saying I shouldn't eat rice, but maybe minimize it and eliminate certain food that is a trigger for inflammation in your body because this is what it's causing for you. You want to eliminate it or you want to minimize it. You know, you're educating them, you're empowering them,
Yes.
you're giving them resources, you're building trust, you're building relationship. That's the key to success. And that's what healthcare
Yeah.
should be.
That's a therapeutic, I call that a therapeutic, trusted, helping relationship. It's not a friend, but it's friendly and it's trusted and it's somebody who has the capacity to help you. But to your point, I love the fact you used empower. That
Yeah,
word is so magical,
it is.
empowering and ennobling patients to take control.
Yeah.
And it really, truly changes their life in a significant way. Who doesn't want to be a part of that?
Everybody wants to because they see it. Because a lot of people sometimes they're very skeptical, right? But once they go through the program from their initial day, you know, they connect with their health coach that help
Yeah.
them guide them through the processes. And that questionnaire that we collect, right? It's a very, very comprehensive questionnaire. We had a client that is also a health plan that said they want to look at our questionnaire, right? They came with their own questionnaire and they saw what we have. They was like, what? Like, how the heck is this even happening here? He's a chief medical officer of a care plan, right? A health plan. That saw that as a whoa. Because we collect a lot of data point, right? You know,
Yeah.
exposure to the environment. You know, what is that environmental toxins that you're exposed to, maybe where you're living, you know, access to
Yeah.
health,
Oh,
all things,
amen.
right?
Yep.
Stress,
Yep.
all the elements. And now what they said, they say, hey guys, we also want you guys, we're gonna delegate the health risk assessment to you guys for us, right? Which is CMS sort of responsibility for them. Now they are now delegating that to SIBA because they love the information we capture and how that information is also going to help them to really assess the risk of every member that they have on that platform today, right? So
Oh,
we're not
yeah.
looking at the condition today, but we're also looking at how can we identify those at high risk and tailor intervention to them quickly before it becomes a problem. So you're preventing the future cost. You're also really preventing that patient from getting some of those conditions today, right? So it's really, really a multi-strategy and it doesn't happen in isolation, right? So that's why we're also part of the Stonebrook Risk Solution because we're able to partner with partners like you, right? So we see certain data points and then we're able to immediately now navigate and provide you with that information so that you begin intervention before it becomes a problem and anyway, you know, down the road, right? So
Absolutely.
and a lot of the players today now they begin to understand the value of building that ecosystem, right? So SIBA have seen this. I mean, because of some of the experience that I had prior to building SIBA, I was also a co-founder of a company called Kaya Health. So interacted with a lot of head of HR, head of benefits, and then seeing what are the pain points, and then looking at my clinical background, what I also understood, what I've seen, that all came together and say, you know what, we need to build SIBA, and that's how SIBA started. Because when I look at patients with some of those chronic conditions, patients shouldn't be dying for type 2 diabetes. This, if you figure what's happening, you're able to reverse the cause of some of the risk. And what we've seen, most of the patients, as we're reversing some of these trends that they have, we're seeing improvement in other comorbidity that they have, right?
Absolutely.
Either mental health, right?
Ah,
It's
it's
important to
well,
build
it's the
that
one
pathway.
ring that rules them all. So,
Yep.
if you want to have the biggest impact in terms of a group's spend or overall health, I mean, high blood sugars, they drive every other chronic condition. I can't think of a chronic condition that isn't impacted when somebody has diabetes,
Yeah. So this is like,
MSK,
yeah,
cancer. Yeah.
I think this is a typical dashboard, right? That it looks like, so this dashboard is, the patient has it, the provider has it. So you can see that sometimes it's highlighted in red because maybe the data is trending in a certain direction. It flags it, right? And then send the patient to the provider and say, hey, you need to look at this patient. There's certain trends that we're seeing here that, it's not looking good at all, right? So again, this dashboard probably would be a lot better than what it is today. It is an older one, and the goal is really looking at, how those connected devices are really helping empowering patient, integrating that back into the remote patient monitoring capabilities, and a dashboard that provide visibility, transparency, and then be able to look at the impact we're making really in the overall patient health. But the most important thing is not fancy technology, but really our ability to deliver care, a care that has a human face, a care that really look at patients as a unique, understanding their unique biochemistry, genetic makeup, and then putting together an intervention that is tailored for them, right? For their need. And how do we leverage in food as medicine, right? So you're able to personalize care based on this patient data. And so, okay, this food, when you eat this food, your body will react in a certain way. So maybe you minimize it, right? And all that. So it's important to really be able to leverage this key elements to be able to deliver this care, mostly patients with chronic conditions like type 2 diabetes today. So I know I've been doing a lot of talk, right? So
Well,
maybe I'm gonna add another point here around the GLP-1 too. So we have what we call the GLP-1 step therapy. What
yeah,
that does is for us to be able to put the guardrails. A lot of times patients, they need them, they can't even have access to it. So
yeah,
what are we doing in the interim, right? Do you have a solution that can help them along the way before they begin to even get this GLP-1, right? Then sometimes the patient, they don't really need a GLP-1. They just need to make some changes, right? I mean, and
yes,
that's what they help, right? So
yeah.
how are you looking at that really to helping the patient understand why? Because sometimes it's also a mental thing. They just think, oh, the GLP-1 because of TV
I saw a
commercial.
commercial. Yeah.
Oh, I will get it. They think it's a magic pill, but
Is
ignore,
anybody else sick and tired of all the pharmacy commercials? I'm
I'm
just
telling
saying.
you, yeah, and ignoring the risk, there are also risks to this medication, right? There are risk factors associated with that. You do muscle mass loss, like, you
Yeah.
lose what happens, right? You have all those nausea and all that. Well, this is are there, but the muscle mass loss is a problem. Someone who is 300 pounds loses 150 pounds within 3 months. What happened to the loose skins, right? I mean, that's an additional cost, right? And they have to go to see
Surgery and yeah.
exactly. That's
Yeah.
cost. So why
Yeah.
don't you do it in a sustained way? If you're able to lose 30 pounds or 3 pounds every month, that's sustained because it's looking at data, it's adjusting until probably you get to 30 pounds or 50 pounds and you lose those weight, right? But the most important thing is also how do you drive this patient to also understand the value of what you're doing today? What are they going to get out of it? Because they're tired of all the solution every day, but
Yeah.
you have to provide them with a solution anyway, right? So the key element is empowering patients. For us, we don't play with that. We don't just say it. You want to empower them. You want to provide them with tools. You want to provide them with, what's going on. How can they better manage their own health? And then how can they be
Yeah.
involved, right? You have
Yeah.
to build trust. You want to build a relationship, right? So this is a key element that is certainly missing in the care model that we have today. And so Siba is suddenly in this space to see how can we really continue to deliver value? How can we make impact? Right? And in the day, yes, investors want to make money, but for us, the key element is impact. How do you make those impact? And then how does that translate into what you do today? And this is the reason why, for me, I believe not just being on the patient bedside, but also being in a space where I can impact not within my community, but global, right? I
Yeah. Whole
mean,
populations you can benefit.
global, very
Yeah.
important. Yeah. So
Yeah.
I know I do a lot of talking, and once I get into that zone, I go on and on and on. But I want to give you guys,
Well, tell
some.
us a little bit about the Instacart thing. I saw that on LinkedIn and you mentioned it before we
Yes.
clicked. Tell us a little bit about that too.
Very important, right? So when you look at access to the places we call the food desert, right? A lot of times, sometimes patients don't even have access to healthy food. You're asking them to make some changes. Can they even afford it, right? It's they maybe even they can afford it. How do they even access it? So what we did was look at Instacart is already all over the US. They're delivering, to almost every corner around the US today because they have the technology, they have the resources to do that. So what we're thinking is, okay, we're asking patient, we're personalizing the diet for patient based on what we see from a data point. And how easy is it for them to access it? So we decide to integrate Instacart into our model, right? The patient is able to really, once we make recommendation, they're able to see that and select and it get delivered, right? So there's a voucher that gives them discount. And then sometimes the employer pays for it already, right? So it's already part of the whole bundle that we offer the services for. So we think it's certainly going to be a very important,
Well, you
really.
will come over and cook for me.
Yes, absolutely. It's certainly going to be a game changer, right? To this, right? So now you're saving time, you're getting this already prepared for you. So you don't have to deal with the stress of thinking about how do you put all that together, right? It's there for you now. It's just
Well,
getting shipped.
what that makes me think of is that, for so many people, when you think about how diabetes develops, if you just step into people's lives. Most people, and whether you work outside the home or inside the home, you have the door running at 7, whether you're a cup of coffee and a muffin, all you've got on your tank is kindling on your fire, right? You've only got carbs. And then you
Yes,
wonder why you have no energy at 10, but there's the vending machine or there's donuts in the break room. So I'm going to grab some
exactly.
or Diet Coke real quick. And then it's lunchtime where we're going out to lunch and we're stopping by McDonald's. And then it's the end of the day. And we've got 2 hours to spend with the people that mean the most, is why we work so hard all day. And you want me to put on an apron and be Donna Reed, right? And who has time to, and then and then you want me to exercise? Holy heck, did you?
Exactly. No, exactly. That makes the whole lot of it's certainly very important. So that's for us is access, right? Convenience too, right? And options, right?
Well, in
So
training, I think a
yeah,
lot of people, and
Correct.
it sounds kind of silly, but a lot of people out there don't know what healthy looks like.
Correct.
It's
Yeah.
got to
And
come in a
that's,
cellophane wrapper, right?
yeah,
yeah.
yeah.
You were going to say
Like,
something, Stephanie.
yeah, no, you make an excellent point, especially with vending machines. I have a lot of patients that they think, because they don't have the time to get stuff, they get something from the vending machine and they say, well, portion control, quote
Yep.
unquote, I'm going to have sausage biscuit instead of the two. But then when you actually look and break down, the macronutrients, the nutritional data for that just one sausage biscuit, it ends up being like in a ridiculous amount. Like it contains enough sodium for their whole daily intake. So just
Yeah.
showing them that, and my best way is always food journaling. Show me what you're eating on a regular basis.
Exactly. Yes.
Calculate how much sodium your intake is. Let me calculate how much carbs you're actually eating. Because if you put it to perspective and kind of, put it in a model that they can understand, it's going to be much more eye opener versus their day-to-day basis. They're just going through life. So yeah.
Absolutely. That's why we have dietitian, right? Looking at the full journaling, and it has to, because it's not gonna work when you just ask the patient to do it, right? So, you're also looking at accountability, right? So when they do that, they know that you're gonna ask them, did you do this, right? Because it's important for them to understand if they do what you ask them to do. But again, they also see reason why you ask them to do that, right? It's
Mhm.
there. And that on itself is very compelling, right? So it makes this patient begin to think a little bit different. It makes it begin to understand the value of what you're doing for them. And then once they take that, they now will be engaged and involved in all the process. And they will be the one reaching out to you and say, hey, I noticed this, what does that mean? Right. So it's suddenly, I'm excited about, what we're all looking to do today, and even that relationship with Magna Care, right? I mean, as you said, so for us, it's going to be a test point for us to show that, we're building a healthcare model that really will provide those patients with what they need on the one right platform, rather than getting to navigate and go here today and do that, point solution fatigue. So certainly this is an exciting time, and really again I'm excited to really the partnership that we're looking to really build here. And always happy to share, learnings, insight and all that, and and learn from you guys as well, right? So we're learning every day. The point that Kimberly made to us well in terms of food. I remember during my residency days, right? So I will go to there's a Wendy's by the Columbia University Hospital, right? So you go grab quickly
Yeah.
your call, you have no time. But if you can get this really delivered to you, that it's at no cost to you, what else are you looking for? I mean, really, it's already organized for you based on, you as, because there's gonna be a lot of questions around culture, right? Understanding, what you want. And so
Yeah.
it's personalized based on you as a person, not just saying, oh, you just stick to this. No, we want to understand your lifestyle, whatever this is, and then put together that sort of, plan for you, which would include the food journaling, of course. I mean, you taking the picture and telling us what you eat and what is that, right? And understanding the risk involved in every decision you make as a patient.
Yeah.
So
And
much better
accountability.
than, oh, go ahead.
No, like I was like the doctor was mentioning, accountability is so important and transparency. I always tell my patients, just because we're trying to do our best doesn't mean that every day is going to look the same, and doesn't mean that every
Ah,
day we're going to do our best. But
no.
it's just not only being honest with your, clinician, but be honest with yourself and know
Yourself.
that it's okay to fail and just get up and try again the next day.
Amen.
Yep. Accountability. Accountability is
I
the
think too, your approach where you have physicians there and your dietitian. I mean, there's that one of the other things
Care
that I think,
managers, right? It's important to ensure
yeah,
that these are all part of the whole, the model, right?
instead
Everybody.
instead of Dr. Google, right? I know Nancy's had a
Exactly.
member
But
who,
all of them communicating at the same time and seeing that data, information that
yeah,
they share, right? Because that is also understanding why the doctor is making the decision, not just doctor making the decision, but when the dietitian put a plan together, the doctor also understand why, right? Because they see it real time.
yeah, yeah, yeah. Well, kind of like I know I was going to have Nancy share a little bit. We've had members who, they do their best to get information, and sometimes very, knowledgeable patients, but there's so much information out there that's kind of fatty. Like we'll see people who, well,
Yep.
I know carbs aren't good, so I'm going to cut out carbs. And then you look at their plate and they've got a whole day's worth of protein there, which
I know.
and then they wonder why their glucose is still high. And that is that's a heavy burden on a kidney, which Nancy had a
Of course.
member who did
Of
that as
course.
well. So,
No, I
or
have time. I mean, if you get
fasting, or
extra time, yeah, for you guys, and you can share, what you guys are doing. And really, again, I think for me, at the end of the day, I learn every day, and really, and as well as thinking, how can we begin to think about healthcare differently? When I also look at healthcare with a human face, right? I mean, if you look at some of those, uh, um, awards or whatever that we've been getting today, it's not because, we're still like, less than 4 years, right? I mean, we started in 2020, but because those impacts are there. People are beginning to see them really, and that's what's making the difference today.
yeah, well, I think there are plenty of companies out there that provide management, and that's all. I'm not knocking that at all. We need that. But to be able to reverse a condition where that's obviously such a passion that Siba Health has and is able to deliver that in the marketplace. And most people don't know that. When we talk to people, we've had people tell us, a lot of our members say, well, nobody's ever told me I could reverse it. Right? That's a revelation to people.
Yep,
Oh,
exactly.
my mama had diabetes and my grandma had diabetes. And sometimes you have to, it's not just a genetic thing, it's a table thing.
Exactly. So it's important, right, to ensure that, because most of the chronic condition today, honestly, if you look at the root causes of this, you fix it, you reverse it. I mean, it's not magic. The
Yeah.
data is there to point to that, right? I mean, you just need to ensure that you're getting the patient involved, you're empowering them, giving them understand what you need to do, what they don't have to do, right? I mean, not just preventing, stopping them, but showing it to them practical. They should understand that, right? And then,
It's interesting because that's not complicated. If it hurts my finger when I slam the car door on it, if I stop slamming the pain goes away. That's a novel concept. It doesn't have to be.
Exactly.
Yeah. Well, I
Yeah.
definitely want to save some time for questions when we have a brilliant physician on the phone or on with us. Because we deal a lot with these kind of folks. I'm super excited to be able to partner with you and sharing what you're doing in the marketplace is so impactful. But what questions do we have for Dr. Clement?
I have a question.
Yes,
Do you
please.
get patients that are really heavy, like the 350, 400-pound patients? What do you do for those patients? Is the bariatric surgery is really an option, or is that discussed too?
No, I mean, 100%. This is really a very good question too, right? So, and for us is we just don't look at anything we do in isolation. We want to look at the entire picture overall, right? So, which means it include, all this element that you just mentioned today, because it's important as you make decisions, you're evaluating that, right? So there are other options that has to be on the table because sometimes this intervention might not really work for everybody. So you have to ensure that those key elements are there, right? So and now the bariatric surgery, suddenly if there's a need for it, you see it, absolutely, right? Not just because a patient wants it, right? But it has to be based on the data and looking at the risk, for this patient. Can they go through this? And so everything we do, it's very, very inclusive of every data point that we look at that gives us an overall, overview on this particular individual and understanding how can we better support this individual, right? So this is also an element that is on the table.
Sounds like a really tailored approach.
Yes,
Mhm.
very tailored.
Yes.
Yeah, it's very tailored. Like, so you will look at individual, whatever data that you have, right? If there's a need for that, yes, suddenly we're able to say, you know what, you probably need to get this done, right, to help you because 300 pound, you don't just lose that, you know, it takes time and not everyone is patient enough to go through that. But what I've seen, so if you're also taking care of the inflammation causes a lot of problems in your body. You're able to eliminate and clear that out. I guarantee you begin to see that weight loss happening, like, you know, on average, we see 30 pounds weight. So again, when you're looking at someone with 300 pounds, it's not a lot, right? But if you clear out all that and the patient really, really follow through with the instructions, you will see significant really weight loss there. But then when you're not bring the patient to where it's safe for you to be able to even go to the surgery, because sometimes if it's not, you know, the patient, it's not stable enough to go through a surgery, nobody's going to do a bariatric surgery, right? So you brought the patient to a situation where that patient now cannot go in and do a surgery and come back, you know, excellent, right? Which means the health of that patient is improved. The outcome after the surgery will also be better.
Yeah, that's great.
Nancy, you've been quiet.
Yeah, no, I like how you guys take the approach of going to the root cause of, whatever diagnosis they have, because I
Yeah.
feel like in today's world, we just like to treat the symptom, treat the symptom, treat the symptom. And that really gets us nowhere except
Yeah.
medications,
Yeah.
but I like your point where you said that, you treat the root cause of it, and that's how you really get off the medications. That's how you really, solve these issues. So I 100% agree with that. I like that.
Yeah. Awesome. Thank you.
I've not yet met a patient,
Yeah.
a person
Yeah.
who wants to be sick, who wants to be fat, who wants to not have energy at the end of a day, who wants to end up in a dialysis chair or in liver failure.
Yeah.
It's just interesting because I think sometimes too in healthcare we put, and especially in our industry where we're working with a lot of patients on dialysis, there's a lot of shaming of these patients. Well, they wouldn't be here if they would have done what the doctor told them to do. Well, for most people, they go in, they have 5 minutes with the doctor, and the doctor tells them to go home and lose weight, get their A1C down, drop their cholesterol, and they say, "Well, if I knew how to do that, I wouldn't be here in the first place."
Yeah.
So
Exactly.
I just think, the approach that you described today, it lights me up like nothing because it's so respectful. It honors that patient in the center. And when we do that, which a lot of us, that's why we're in healthcare, doctors and
Yep.
nurses, we work
Yes.
really well together because we really do want to take care. And when you do take care of that patient in the center, everything else gets taken care of.
I think, yeah, yeah. And really, it shouldn't be doctor that make all the decisions. We all are stakeholders, right? I mean, this is something that is suddenly completely missing in the overall healthcare. Doctors think, oh, we are the doctors, we know it all. No, you have to work, build that collaborative approach, really between different stakeholders within the healthcare.
The right
Everybody
tool for the right
has-
job. I don't need a jackhammer to hang up the picture on my wall. Is that what you're saying, Doc?
You know, doctors always come and again, I'm a physician, but for me, I disagree with the approach, how they look at it, they make all the decisions. Now, we have to look at everybody who is part of that care model for this patient to ensure that you value every input everybody makes there. And that's why we build that sort of circle that you see there,
Yeah.
providing that care coordination so that information sharing, it's really seamless, so that I see why you're making the decisions. There's a data that supports that. Same thing happened with the nurse care manager. Something happens with same thing would happen with the dietitian or the doctor, right? So it's not saying, oh, doctors, we know it all. No. Everybody here, let's all work together collaboratively. Let's help this patient get better. It has to be a collaborative approach. There's
Yeah.
no person that has the entire answers to that. When you do that, you're not gonna, if you don't do that, then you're not gonna get the desired results.
I love how you speak on a root cause analysis because, I mean, personally, me working in critical care for so long, root cause analysis was only brought up with medical error prevention and for sentinel events. But like, if you really think about it, the root cause analysis, should be utilized in all aspects of patient care in order to give patient-centered care. So I just find that very interesting because I heard that word and I was like, oh boy, because it just took you back, when you are in the hospital, it has almost like a negative connotation, but in this particular aspect, it's like, wait a minute, no, it shouldn't have such a negative impact.
Absolutely.
If
Yeah.
anything, it should be a positive one. So that
Yeah.
was refreshing.
Yeah.
Yeah. Yeah. Well, Dr. Clement, thank you so much for joining us today. If people, because we're going to share this far and wide, if people have questions or they want to get to know you or your team at Siba better, how do they find you? How do they reach out to you?
So, I mean, there are two ways or different ways that they can reach out to us. You can go on our website. You can really request to connect with the care team. I mean, there's a link there that will take you. Once you put information, it goes to the care team, right? And the nurse care manager will reach out to you and then schedule an appointment for you to connect with the provider. I mean, if they want to email me directly, they can email me, So the is Clement@sibahealth.com. But most importantly, it's easier for them to go on the website, right? Click on the link, and connect with the care team, and the care team will certainly direct you to where you need to go and then provide you with the information that you need. And if you think it's helpful, and you're able to also then join Siba and then begin to see, how we build a model that's different, that is changing the face of healthcare today, mostly patients with some of the metabolic is, type 2 diabetes, pre-diabetes, even obesity inclusive, right? So it's a different care model, and this care model that is suddenly impactful and suddenly compelling to allow patients to live their life, a healthy life, from, empowering them as well. So I'm excited to always be part of this conversation and continue to share and learn from all of us here that are here today. And so I'm excited.
Well, me too. SibaHealth.com is with a C. C is in Charlie, C-I-B-A. We'll share it. Dr. Clement, thank you again so much. So great to get to chat with you in person. Can't wait to meet you in person for sure.
Yeah, I can't wait. I mean, I'm sure there's going to be a lot of opportunities for us, right? Conferences or, when we're launching this Magna Care officially. And then I think there might be a lot of opportunities, but suddenly, maybe next time I'll bring our chief medical officer who's suddenly really way passionate than I am. And maybe speaks even, very compelling at what I actually shared today. And you'll learn from her. We're happy to always provide this sort of environment where we can also exchange learnings, exchange ideas and learn from each other and continue to build a healthcare model that I consider is the new healthcare today that has a human face. So I'm excited and then look forward to learning from you, and then hopefully, we'll find some time to all collaborate.
Absolutely. Changing the game, Doc. That's what we're out for.
Thank you all.
Thanks.
Have a wonderful rest of your day.